welcome to a deep dive into the world of maternal and child health care.
Oh,
A field that's as vital as it is complex.
Mm-hmm.
And we're going to uncover some fascinating insights.
Yeah.
For our listeners out there who are nursing students, this is going to be a great deep dive for you.
It is.
So we're going to explore everything from the historical evolution of childbirth to the modern challenges facing families, all through that lens of a nursing student.
It's really about understanding the big picture.
Okay.
You know, how did we get to where we are today?
Yeah.
What are the key factors influencing the health of mothers and children?
Mm-hmm.
And what role do nurses play in this ever-changing landscape?
Yeah, exactly.
Mm-hmm.
So let's start by stepping back in time.
Okay.
Can you imagine?
I know, it's hard.
Childbirth in colonial America.
It's fascinating.
We're talking high mortality rates, limited medical interventions, and a very different understanding of child development.
It's a stark contrast to the world we live in today.
Oh, yeah.
You know, back then, children were often seen as, well, more hands to help with work.
Oh, wow.
But as we moved into the 20th century, a profound shift began.
Okay, so here's where it gets interesting.
Mm-hmm.
Hospital birth became more common. The natural childbirth movement emerged.
Yeah.
And we saw the rise of specialized roles like certified nurse midwives.
Exactly.
What's fascinating is how these changes reflect evolving societal views on childbirth and the role of women.
Take the natural childbirth movement, for instance.
Okay.
It wasn't just about pain management techniques. It was a philosophical shift that emphasized a woman's innate ability to give birth.
Wow.
And advocated for her active participation in the process.
Okay.
You know, it brought fathers back into the delivery room.
Oh, wow.
And challenged the medicalization of childbirth.
That's a really important point.
Yeah.
It wasn't just about medical advancements.
Right.
It was about empowering women.
Yeah.
And recognizing their needs and choices.
Mm-hmm.
And this shift had a ripple effect on maternity nursing as well.
Absolutely. We saw maternity nursing evolve from a task-oriented approach to a more holistic model focused on education, support, and empowering women to make informed decisions about their care.
So we've gone from childbirth as a potentially life-threatening event to a more family-centered experience with a focus on the emotional and psychological well-being of both mother and baby.
It's amazing.
What a transformation.
And this focus on well-being extends to children as well.
Mm-hmm.
You know, the recognition of children as individuals with their own rights and needs has driven significant advancements in child health care.
Right.
Think about the impact of public health initiatives like vaccinations and safety campaigns.
Yeah.
They've dramatically reduced childhood mortality rates.
But while we've made incredible progress, there are still challenges, especially here in the U.S.
Right.
It's shocking to learn that our maternal mortality rate is actually rising.
It's true.
Which sets us apart from
it's alarming.
Other developed nations.
Yeah.
How can that be?
Well, it's a complex issue, and this is where the maternal mortality ratio comes in.
Okay.
You know, this measures the number of maternal deaths per 100,000 live births.
Okay.
The U.S. ratio is alarmingly high.
Wow.
And when you break it down by race, a disturbing disparity emerges.
You're talking about the fact that African-American women face a 3 to 4 times higher risk of pregnancy-related death.
That's exactly right.
Compared to white women.
It's a staggering statistic.
That's a staggering statistic, and it points to systemic issues that need to be addressed.
And that's the key point here.
Yeah.
It's not just about individual choices or access to health care.
Right.
It's about addressing the underlying social determinants of health that put certain groups at greater risk.
Okay.
You know, factors like poverty, housing instability, and lack of access to healthy food all contribute to these disparities.
So it's a much bigger picture than just healthcare, right? It's about social justice and equity.
Mm-hmm.
And it's something that nurses need to be acutely aware of as they care for mothers and children.
Absolutely.
From diverse backgrounds.
It's a fundamental part of nursing care.
And as we delve deeper into this topic, we'll explore these issues further.
Mm-hmm.
But for now, let's shift our focus to infant mortality rates.
Okay.
That's another area where the numbers tell a story.
Right.
Congenital anomalies, which are birth defects and prematurity, are leading causes of infant death.
Yes. It's heartbreaking.
These are heartbreaking realities that underscore the importance of prenatal care and early intervention.
It's about understanding the factors that contribute to these conditions and advocating for policies and programs that support healthy pregnancies and births.
Right.
Nurses play a vital role in educating families, identifying risk factors, and connecting them with resources.
We've covered the historical landscape, some sobering statistics.
Yeah, it's a lot to take in.
Now I think it's time to zoom out. And explore the real-life factors that shape maternal and child health.
Right.
We can't talk about this topic without considering the various family structures and dynamics at play.
We've moved beyond the traditional nuclear family model. Today's families come in all shapes and sizes. Single-parent, blended, same-sex adoptive foster care. The list goes on. And each structure presents unique challenges and opportunities.
And this is where nurses need to be incredibly sensitive and adaptable. They need to understand the unique dynamics within each family and tailor their care accordingly.
Precisely.
Take divorce, for example. It's a common experience for many families, and it can have a significant impact on children.
It can.
So tell me a little bit about that.
Well, children of divorced parents are at a higher risk for emotional and behavioral problems. And nurses need to be equipped to recognize these signs and provide support.
Right.
Open communication with both parents, age-appropriate explanations for the child, and connections to resources like support groups can make a real difference.
And then there are single-parent families who often face immense pressure.
Oh, absolutely.
Trying to balance work-child care and finances. Nurses can play a crucial role in connecting these families with community resources.
Absolutely.
Offering emotional support and advocating for policies that promote work-life balance and affordable childcare.
These are essential support.
And let's not forget about adoption and foster care, which bring their own unique set of considerations.
They do.
These families may need extra support in navigating complex medical histories or addressing potential trauma the child may have experienced. Building trust and rapport is so important in these situations.
It's essential.
Nurses need to approach these families with sensitivity, understanding, and a willingness to listen and learn from their experiences.
It's all about meeting families where they are and providing individualized care that recognizes their strengths and addresses their specific needs.
Now, before we move on to parenting styles, I want to stop and ask you, as future nurses, what stands out to you so far? What are you already noticing about the complexities of maternal and child health care?
Well, I think it's clear that understanding family dynamics is a crucial part of providing effective care to mothers and children. And, as you'll learn in your nursing practice, there's no such thing as a one-size-fits-all approach.
Right. And speaking of diverse approaches, let's talk about parenting styles. It's a topic that often comes up in nursing school.
It does.
And one that can sometimes feel a bit overwhelming.
Yeah, it can be. It can be helpful to think of parenting styles as a spectrum. With 4 main categories: authoritarian, authoritative, permissive, and uninvolved. Each style has its own distinct characteristics and can influence a child's development in different ways.
So for those who might need a quick refresher, can you break down these styles for us?
Of course. Authoritarian parents are often described as strict and demanding, with high expectations and a focus on obedience. Authoritative parents, on the other hand, set clear limits, but also offer warmth, support, and open communication. Permissive parents are more lenient, allowing children a great deal of freedom with few rules. And uninvolved parents are, largely detached from their child's life, providing little guidance or support.
And how did these styles translate into real-world parenting? What are some examples of how these styles might play out in a family setting?
Imagine a child asking to stay up past their bedtime. An authoritarian parent might say, no, it's bedtime, end of discussion. An authoritative parent might say, I understand you want to stay up, but it's important to get enough sleep. How about we read one more book together before lights out? A permissive parent might say, sure, stay up as late as you want. And an uninvolved parent might not even be aware of the request.
Those are great examples. And as future nurses, it's important to remember that these styles are not inherently good or bad. It's about recognizing how a particular style might be influencing a child's behavior or well-being. And adjusting our approach accordingly.
Absolutely. And it's crucial to remember that every family is unique. What works for one might not work for another.
Right.
Our role is to observe, listen, and provide guidance and support
that
aligns with the family's values and needs.
And speaking of guidance and support, let's not forget about discipline.
Right.
Which is another key aspect of parenting.
It is.
It's a word that often gets a negative connotation.
Yeah, I know.
But it's really about teaching and guiding children, right?
Absolutely. Discipline is about setting clear boundaries and expectations, helping children understand the consequences of their actions, and fostering their self-control and decision-making skills.
But it's not about punishment or making a child feel bad, right?
Precisely. Effective discipline should focus on positive reinforcement. Rewarding desired behaviors and providing clear and consistent consequences for unwanted behaviors.
So what are some practical strategies that nurses can share with parents who are struggling with discipline?
Well, one effective technique is called extinction, which involves ignoring unwanted behaviors such as whining or tantrums to remove the reinforcement those behaviors might be getting. Of course, this needs to be done safely and appropriately, and it might not be suitable for all situations. Another widely used strategy is timeout. Which can be effective for giving a child a chance to calm down and regain control.
So the key here is consistency and age appropriateness.
Absolutely.
Parents need to be on the same page. And the discipline strategy should be tailored to the child's developmental stage.
Exactly. And it's so important to emphasize the difference between discipline and punishment. Punishment is about inflicting pain or suffering, while discipline is about teaching and guiding.
It's about preserving the child's self-esteem.
Exactly.
While still setting those boundaries and expectations.
Now let's zoom out even further. Parenting doesn't happen in a vacuum. We can't talk about maternal and child health without considering the broader societal and cultural influences at play.
And this is where things get really interesting. It's about understanding how factors like socioeconomic status, media exposure, and globalization shape the lives of families and influence their health outcomes.
Socioeconomic status is a powerful predictor of health. Poverty, in particular, is linked to a whole host of challenges, from inadequate housing and food insecurity to limited access to healthcare and quality education.
It's a heartbreaking cycle.
It is.
Children living in poverty are at a significantly higher risk for chronic health problems, developmental delays, and educational disparities. And the statistics on homelessness are especially alarming.
It's a stark reminder of the social inequalities that exist in our society. And the urgent need to address the root causes of these disparities. Nurses can play a crucial role in advocating for policies that support families living in poverty and connect them with resources to meet their basic needs.
And then there's the pervasive influence of media, which is something no family can escape these days.
It's true.
It's a double-edged sword, isn't it?
It is.
On the one hand, media can be a powerful tool for education, entertainment, and connecting with others. But on the other hand, excessive screen time exposure to violence and unrealistic portrayals of body image can have detrimental effects on children's physical and mental health.
It's all about balance and mindful media consumption. The American Academy of Pediatrics has developed some excellent guidelines for parents, recommending limited screen time for young children, creating family media plans, and encouraging open communication about online safety.
So it's not about demonizing technology.
No.
But about teaching families how to use it responsibly. And create healthy habits. And speaking of diverse influences, let's not forget about the impact of globalization. We live in an increasingly interconnected world, and nurses need to be prepared to care for families from a wide range of cultural backgrounds.
Cultural competence is paramount in healthcare. It's about understanding and respecting different beliefs, practices and values related to health and illness. We might encounter families who rely on traditional healers or alternative medicine practices. And it's important to approach those beliefs with sensitivity and open-mindedness.
Sometimes those practices can be complementary to Western medicine. But other times there might be conflicts. It's about having those open conversations, building trust, and finding ways to bridge those differences.
And it's about recognizing that health is not just about physical well-being. It's also about mental, emotional, and spiritual well-being.
It's a holistic view of health that takes into account all aspects of a person's life. and recognizes the interconnectedness of mind, body, and spirit.
Now, before we shift gears to some of the ethical considerations in maternal and child health care, I'm curious to hear from you.
Okay.
What are some of the key takeaways you're gathering about the social and cultural factors that shape families' lives?
Yeah. It seems like there are just so many layers to consider.
There really are.
When we're thinking about the health and well-being of mothers and children.
Absolutely. And speaking of holistic care,
okay,
we can't overlook the impact of individual health status and lifestyle choices, for expectant mothers.
Yeah.
Things like nutrition, exercise, and avoiding harmful substances are crucial for both their well-being and the health of their developing baby.
You're reminding me of something we discussed earlier, the alarming rise in childhood obesity.
Yeah.
It seems like it's everywhere.
It's a growing concern.
And it's linked to so many health problems later in life.
It is. It's a serious public health concern. And, a lot of it comes down to those lifestyle factors we were just talking about. Nutritionally poor food choices, lack of physical activity, and excessive screen time all contribute to this problem.
So as nurses, we have a responsibility to educate families about the importance of healthy habits.
Absolutely.
Starting from a young age.
Yes, prevention is key.
What are some practical tips we can share with parents?
Well, it's all about setting a good example.
Okay.
And creating a supportive environment, encouraging families to cook meals together, incorporating physical activity into their daily routines.
And setting limits on screen time can make a big difference.
And what about environmental exposures? I'm thinking about things like lead poisoning or exposure to toxins during pregnancy.
Right.
These can have long-lasting effects on a child's development, right?
Absolutely. Environmental exposures can play a significant role in both maternal and child health.
Okay.
For example, exposure to lead, even at low levels, can lead to developmental delays, learning disabilities, and behavioral problems in children.
Wow.
So it's crucial for nurses to be aware of these risks and advocate for policies that protect children from harm.
It makes you realize that nursing care extends far beyond the walls of a hospital or clinic.
It does.
It's about being aware of those broader social and environmental factors that can impact our patient's health.
Exactly. It's about being advocates, educators, and resources for families as they navigate the complexities of raising healthy children in today's world.
Now, it wouldn't be a deep dive into maternal and child health without addressing some of the ethical dilemmas. Yeah, that's an important point.
That nurses often face. These can be some of the most challenging situations
they can be.
We encounter in our practice.
You're right. Maternal and child health often intersects with complex ethical issues.
Right.
And nurses need to be prepared to navigate these situations with sensitivity, compassion, and a strong ethical foundation.
Let's start with a topic that's often at the forefront of ethical debates.
Okay.
Abortion.
Okay.
It's a deeply personal and often emotionally charged issue.
It is.
And nurses need to approach these situations with respect for the patient's beliefs and autonomy.
It's essential for nurses to understand the legal and ethical frameworks surrounding abortion.
Right.
As well as the diverse perspectives and values that people hold on this issue.
Yeah.
Our role is to provide compassionate care and support regardless of our personal beliefs.
Another ethically challenging situation is when a mother is struggling with substance abuse during pregnancy.
Right.
It raises concerns about the well-being
It does.
of both the mother and the developing fetus. How do we balance those competing interests?
Well, it requires a delicate balance of compassion, non-judgmental care, and a commitment to the health of both the mother and the baby.
Right.
We need to provide resources and support to help the mother make healthy choices, while also ensuring the safety and well-being of the fetus.
It's about meeting the mother where she is.
Exactly.
And offering guidance and support without judgment or coercion.
And sometimes ethical dilemmas arise when a mother's choices conflict with what's considered to be in the best interest of the fetus.
Okay.
This is known as maternal-fetal conflict.
These situations can be incredibly complex.
They can be.
Raising questions about a mother's autonomy, her right to make decisions about her own body, and the rights of the unborn child.
Healthcare providers have a responsibility to advocate for both the mother and the fetus, while also respecting the mother's right to make informed decisions about her care.
It often requires a team approach.
It does?
Involving healthcare providers, ethicists, and legal experts to navigate these difficult situations.
Now let's touch on another area where ethical considerations come into play, stem cell research and cord blood banking both hold tremendous potential for treating diseases, but they also raise ethical questions.
Stem cell research, particularly when it involves embryonic stem cells, has been a subject of ongoing debate.
It has.
It's about weighing the potential benefits of life-saving treatments against the moral concerns surrounding the use of embryos.
Nurses need to be aware of the different perspectives on this issue and understand the ethical principles involved.
And what about cord blood banking?
Okay.
It's becoming increasingly popular.
It is.
But there are ethical concerns surrounding for-profit banks.
You're right. For-profit banks have been criticized for their marketing tactics and the high fees they charge. The American Academy of Pediatrics and the American College of Obstetricians and Gynecologists recommend donating cord blood to public banks instead, where it can be accessed by anyone in need.
So it's about making these life-saving resources available to everyone.
Exactly.
Regardless of their ability to pay.
Absolutely. And now let's delve into a crucial aspect of ethical nursing care.
Okay.
Informed consent and confidentiality, particularly when caring for children.
Informed consent is a fundamental principle in healthcare.
It is.
But it can get a bit tricky.
It can.
When we're dealing with children.
Yeah.
Parents have the legal right to make decisions about their child's care.
Right.
But what about the child's voice in all of this?
That's where the concept of assent comes in.
Okay.
You know, it's about involving children in the decision-making process to the extent possible, explaining things in age-appropriate terms and respecting their opinions.
It's about recognizing that children, even young children, have a right to be heard and to participate in decisions that affect their health and well-being.
And then there's confidentiality, which is a cornerstone of ethical healthcare.
Yeah.
You know, children have a right to privacy, and nurses have a legal and ethical obligation to protect their personal health information.
But there are exceptions to confidentiality, right?
There are.
Like when a child is at risk of harm or abuse.
Exactly. Nurses are mandated reporters.
Okay.
Which means we're required by law to report suspected child abuse or neglect to the appropriate authorities. You know, it's about finding that balance between protecting a child's privacy and ensuring their safety and well-being.
It's a heavy responsibility.
It is.
But it highlights the crucial role nurses play in safeguarding children.
Absolutely.
Sometimes ethical dilemmas arise when parents refuse medical treatment for their child.
Right.
Perhaps due to religious or cultural beliefs.
These situations can be incredibly challenging.
Yeah.
And it's important for nurses to approach them with sensitivity and respect for the family's beliefs. You know, it's about finding common ground.
Yeah.
Educating the family about the risks and benefits of treatment.
Right.
And exploring alternative options whenever possible.
But what happens when those refusals pose a direct threat to a child's life?
Well, in those extreme cases, the legal concept of parens patriae might come into play.
Okay.
You know, it essentially means that the state has a right and a duty to protect children, even if it means overriding a parent's decision.
So in those situations, healthcare providers might have to seek legal intervention.
They might.
To ensure the child receives necessary medical care. It's a complex and emotionally charged situation.
It is.
But it underscores the importance of advocating for our patients' best interests.
Yeah.
Even when it's difficult.
You've just completed a deep dive into a vast and multifaceted field.
It really is.
As future nurses, you'll be stepping into a world where you'll encounter all of these complexities and more.
Wow.
So, you know, be prepared to think critically, to advocate for your patients, and to never stop learning.
It's clear that maternal and child health nursing is not just about providing medical care. It's about understanding the social, cultural, and ethical dimensions that shape the lives of families.
And remember, you don't have to have all the answers.
That's good to hear.
It's about being curious, asking questions, and constantly learning and growing as you navigate this incredible and rewarding field.
We've barely scratched the surface today, but hopefully this deep dive has sparked your curiosity.
Yeah.
Given you a glimpse into the incredible world of maternal and child health care.
Keep exploring, keep learning, and keep advocating for the health and well-being of women, children, and families.
And remember, you have the power to make a real difference in the lives of your patients.